What if three sweet, juicy fruits could do more than just satisfy your cravings? What if they could actually help lower your blood sugar, repair nerve damage, protect your kidneys, strengthen your heart, and even fight off cancer and joint pain, all without spiking your glucose? In this video, we're revealing three of the most underrated fruits for diabetics. One that hydrates your body like medicine, one that protects your vision and DNA at the same time, and one that improves insulin function while calming nerve pain and helping you sleep. These aren't your typical diabetic-safe fruits, and by the end, you'll know exactly how much to eat, when to eat it, and how to turn them into powerful blood sugar-friendly meals. Plus, at the last of the video, you'll get exclusive bonus tips on how to use fruits even more effectively to support your diabetes journey. Stay with me, because the third one might be sitting in your kitchen right now, and you've probably been avoiding it for the wrong reason. First on list, cantaloupe. Few fruits say refreshing quite like cantaloupe. With its rich orange flesh, juicy bite, and mild floral aroma, cantaloupe is often seen as a summertime indulgence. But beneath that soft sweetness lies a surprising ally for people with type 2 diabetes. Despite its naturally sugary taste, cantaloupe is remarkably diabetic-friendly when eaten the right way. Its glycemic index is approximately 65, which may sound high, but its glycemic load is only about 4 per 1/2 cup, meaning its actual effect on blood sugar is gentle and gradual. This is due to its high water content, fiber, and low energy density, all of which work together to slow glucose absorption and support balanced blood sugar levels throughout the day. Each 1 cup serving of diced cantaloupe contains just 53 calories, 13 grams of total carbohydrate, and 1.4 grams of fiber, a clean, manageable carb load that fits easily into a diabetic meal plan. But its real power lies in the volume of healing nutrients it delivers with such a low calorie count. That single cup supplies over 100% of the daily value for vitamin A in the form of beta-carotene, a potent antioxidant that protects the retina, reduces inflammation in blood vessels, and slows nerve damage caused by oxidative stress. It also offers 95% of the daily value for vitamin C, which supports immune health, skin repair, joint collagen formation, and helps reduce HbA1c levels by calming systemic inflammation. Beyond the basics, cantaloupe is a mineral-rich fruit. It delivers potassium, 12% of the daily value, to help regulate blood pressure and support smooth muscle function, which can ease the burden on both the heart and kidneys, two organs often affected by long-term diabetes. It also contains magnesium, 5% of the daily value, which is essential for insulin signaling and blood sugar metabolism, along with small but meaningful amounts of folate, choline, and B-complex vitamins that aid in nerve protection and red blood cell formation. One of cantaloupe's most powerful roles is in hydration regulation. With over 90% water by weight, it helps rehydrate tissues and supports electrolyte balance without adding sodium or processed sugar. For diabetics prone to dehydration, especially during hot weather or periods of high blood sugar, this hydration factor is crucial. It prevents glucose concentration in the blood, supports smoother kidney filtration, and reduces the risk of dizziness, fatigue, and sugar crashes. It also acts as a natural detoxifier, helping flush out excess sodium, uric acid, and waste metabolites through urine, which supports kidney function and reduces fluid retention. What's lesser known is cantaloupe's protective role against cancer development. The fruit is rich in carotenoids like beta-carotene, lutein, and zeaxanthin, which help neutralize harmful free radicals before they can damage DNA. These antioxidants are especially protective for tissues that are vulnerable to oxidative damage in diabetics, such as the pancreas, colon, and liver. Some emerging research suggests that regular consumption of carotenoid-rich fruits like cantaloupe may lower the risk of pancreatic, breast, and colorectal cancers, particularly in people with elevated insulin resistance. The vitamin C in cantaloupe further supports cellular repair by boosting glutathione production, a master antioxidant, and strengthening immune surveillance against abnormal cell growth. Cantaloupe is also a powerful natural support for joint health, particularly in older adults and seniors managing diabetes. The high vitamin C content helps stimulate the production of collagen, which is the foundational protein in cartilage, tendons, and ligaments. By supporting cartilage regeneration and reducing joint inflammation, Cantaloupe may relieve stiffness and pain associated with osteoarthritis and diabetic joint degeneration, especially when consumed consistently. Potassium in cantaloupe helps regulate muscle contraction and reduces fluid buildup around joints, offering additional relief to those with chronic joint pain or limited mobility. Digestively, cantaloupe acts like a mild tonic. Its gentle fiber and natural enzymes soothe the gut lining, reduce bloating, and support the growth of beneficial gut bacteria. A healthy gut microbiome plays a direct role in improving insulin sensitivity, regulating hormones, and calming the low-grade inflammation that contributes to diabetes progression. The fiber also slows the breakdown of carbohydrates into glucose, reducing post-meal sugar spikes while improving feelings of fullness and appetite control, something especially helpful for those trying to manage weight alongside blood sugar. There's a persistent myth that cantaloupe is too sugary for diabetics, but this is based on confusion between glycemic index and glycemic load. Yes, the glycemic index is moderate, but when you factor in portion size, water volume, and fiber content, the actual impact on blood sugar is mild and manageable. When paired with healthy fat or protein, the rise in blood glucose is even more stabilized. This makes cantaloupe not only safe, but therapeutic when consumed with intention. For a diabetic-friendly meal that combines taste with science, try blending half a cup of cantaloupe with a few fresh basil leaves, a splash of lemon juice, and a few ice cubes to make a refreshing midday cooler. For breakfast, you can combine cubed cantaloupe with a spoonful of unsweetened Greek yogurt, a tablespoon of chia seeds, and a dash of cinnamon to create a gut-healing, blood sugar balancing parfait that digests slowly and keeps you energized. At lunch, cantaloupe pairs beautifully with grilled chicken and a light summer salad, along with cucumbers, mint, and extra virgin olive oil, a combination that supports hydration, electrolyte balance, and blood pressure regulation. And for dinner, try a cold melon soup blended with avocado, lime, and cilantro. It's hydrating, rich in antioxidants, and easy on the digestive system, making it an ideal side for a light diabetic dinner. Portion control remains important. Stick to 1/2 to 3/4 cup of diced cantaloupe per serving, and avoid eating it alone on an empty stomach if you're prone to sugar spikes. Always wash the rind thoroughly before slicing, as the rough outer skin can harbor bacteria and consume only ripe, but not overripe, melons, as the sugar content increases slightly with overripening. Cantaloupe doesn't just cool the body, it hydrates the cells, strengthens tissues, protects organs, and supports the natural systems that diabetics rely on for long-term stability. When used wisely, this sweet orange fruit becomes more than just a snack. It becomes a low glycemic medicine hidden in plain sight. Up next is a fruit that may be small in size, but packs one of the highest antioxidant and nerve protective punches in the diabetic world. Apricots are coming next, and you don't want to miss how they protect your eyes, your heart, and your DNA at the same time. Second on list, apricots. Don't be fooled by their small size or gentle taste. Apricots are among nature's most concentrated medicinal fruits, especially for those living with diabetes. Their tender orange flesh holds a rare combination of nutrients, antioxidants, and fiber that work together to protect the most vulnerable systems in the diabetic body: the eyes, the nerves, the kidneys, and the heart. Their low glycemic index, just 34, combined with a very low glycemic load of 3 per fruit, means that apricots digest slowly, release glucose gently, and do not cause sharp sugar spikes when eaten in proper portions. That makes them a safe, reliable, and healing fruit for diabetics, even more so when paired with healthy fats or protein to slow absorption further. A typical serving of 1 cup of sliced fresh apricots, about 4 medium apricots, contains only 79 calories, 17 grams of carbohydrates, 3.3 grams of fiber, and just 3 grams of naturally occurring sugar. That same cup provides an impressive 60% of the daily value for vitamin A, primarily as beta-carotene, the same antioxidant pigment responsible for their golden hue. Beta-carotene converts to retinol in the body, which not only protects vision, but also reduces inflammation in the retina and strengthens the delicate blood vessels behind the eyes, making apricots a strong natural ally against diabetic retinopathy. Alongside vitamin A, you also get 27% of the daily value for vitamin C, which helps lower blood pressure, enhance collagen synthesis for wound healing, and protect the lining of your blood vessels and nerves from oxidative damage. Apricots are also a surprising source of potassium, 15% of the daily value, which helps regulate fluid balance, reduce strain on the kidneys, and improve nerve signal transmission. That makes them especially valuable for diabetics prone to neuropathy or blood pressure-induced kidney decline. What many don't realize is that apricots also provide small but functional amounts of magnesium, iron, and copper, minerals that support red blood cell formation, nerve insulation, and oxygen delivery to tissues. This micronutrient trio plays a crucial role in helping prevent diabetes-induced anemia, a condition linked to low hemoglobin levels that often worsens in diabetics with compromised kidney function. When consumed regularly, apricots may help boost oxygen circulation and energy levels, while also supporting brain clarity and memory, two areas often impacted by chronic blood sugar imbalances. Even more impressively, apricots support liver health, a major area of concern in people with diabetes, especially those with elevated triglycerides or fatty liver. Thanks to their chlorogenic acid content, apricots help reduce the accumulation of fat in liver cells, improve detoxification enzymes, and protect hepatocytes from oxidative injury. This makes them a powerful food to prevent or even improve non-alcoholic fatty liver disease, NAFLD, which is increasingly common among those with type 2 diabetes and insulin resistance. By enhancing the liver's ability to metabolize fats and filter toxins, apricots indirectly support better blood sugar stability and lower inflammatory burden. But where apricots truly stand out is in their polyphenol profile. They are rich in quercetin, catechins, chlorogenic acid, and beta-cryptoxanthin, compounds that neutralize free radicals, calm chronic inflammation, and support hormone balance. These antioxidants don't just reduce blood sugar-induced damage. They appear to actively suppress the growth of cancer cells by protecting DNA, regulating apoptosis, the body's natural self-destruction of mutated cells, and limiting blood supply to tumors. Some recent findings even suggest apricot polyphenols may reduce the risk of liver, colon, and breast cancers, particularly when part of a high-fiber, antioxidant-rich diet. For diabetics who face increased cancer risk due to elevated insulin and oxidative stress, this protective effect is not just beneficial, it's essential. And for seniors managing joint pain or arthritis alongside their diabetes, apricots offer additional help. The vitamin C content stimulates collagen production, essential for maintaining cartilage, tendons, and joint flexibility. Meanwhile, beta-cryptoxanthin has been shown to reduce inflammation in joint linings and slow the degeneration of cartilage, offering a mild, natural buffer against age-related joint decline. Regular consumption may reduce morning stiffness, improve range of motion, and ease the joint pressure diabetics often experience as a result of weight gain or chronic inflammation. There's a persistent belief that dried apricots are off limits for diabetics, but the truth is more nuanced. While drying concentrates sugar, a very small portion, 1 to 2 dried halves, paired with almonds or seeds can be safe when part of a fiber and protein-rich meal. The key is never eating dried fruit alone and always measuring carefully. Fresh apricots remain the best option for full-spectrum nutrition with the lowest glycemic risk. A deeply satisfying way to enjoy apricots is to slice 1 or 2 fresh fruits and fold them into a bowl of plain Greek yogurt with crushed flax seeds and a dash of cinnamon. The result is creamy, cooling, and supportive for both digestion and blood sugar control. At breakfast, thin apricot slices layered into overnight oats, made with unsweetened almond milk, chia seeds, and rolled oats, provide a slow-digesting, gut-friendly morning meal rich in prebiotics and antioxidants. Come lunchtime, apricots shine when tossed into a grilled chicken and quinoa salad with arugula, lemon juice, and olive oil, the perfect harmony of sweet, savory, and anti-inflammatory. In the evening, apricots can be gently roasted with thyme and a hint of balsamic vinegar, served alongside lentils or wild rice, creating a rich and elegant dish that supports nerve healing and metabolic balance. Fresh apricots are safe for most people with diabetes when consumed in moderation, generally 1 to 2 fresh apricots per day. But it's wise to avoid canned or syrup-preserved varieties, which often contain added sugars and chemicals that spike blood glucose rapidly. Always wash them before eating and choose ripe but firm fruit for the best nutrient retention and blood sugar response. Here's a fascinating insight. Beta-cryptoxanthin, found in apricots, has been studied not just for its anti-cancer potential, but for its ability to influence gene expression related to inflammation. That means apricots don't just fight damage. They may help reprogram your body toward healing, starting at the cellular level. Before we continue, let me ask, where are you watching from? Drop your city or country in the comments, and let's keep this healthy conversation going. Our journey through diabetic-friendly fruits isn't over yet. Next is a fruit that's dark, juicy, and full of natural compounds that improve sleep, calm blood sugar fluctuations, and even support fat metabolism. Stay with me as we dive into the rich and powerful world of plums for diabetics. Third on list, plums, soft, tart, and deeply satisfying. Plums are more than just a sweet bite in summer. For diabetics, these vibrant stone fruits offer a rare combination of natural sugar control, nerve healing, digestive balance, and cancer protection that places them firmly among the top fruits for long-term blood sugar stability and chronic disease prevention. Despite their juiciness and sweetness, plums are surprisingly low on the glycemic scale. A medium-sized plum has a glycemic index of 35 and a glycemic load of just 4, making it one of the safest fruits for diabetics in terms of blood sugar response. Its sugar is wrapped in fiber, water, and antioxidants, all of which slow absorption and help support insulin efficiency after meals. One fresh medium plum, about 66 grams, contains only 30 calories, 7.5 grams of carbohydrate, 1 gram of fiber, and less than 7 grams of sugar. But that small fruit also delivers powerful nutrients in concentrated doses. A single plum offers 8% of your daily value for vitamin C, essential for collagen production, immunity, and reducing inflammation in the blood vessels. It also provides 5% daily value of vitamin a key nutrient for eye protection and skin repair. Plums are rich in polyphenols, especially anthocyanins, which give the skin its deep purple or red color. These compounds don't just add pigment, they act like cellular bodyguards protecting the pancreas, nerves, and brain cells from oxidative stress, which is the hidden culprit behind many diabetic complications. Plums are especially beneficial for nerve and kidney protection. Their polyphenols have been shown to suppress inflammatory markers that damage blood vessels supplying the kidneys, while their potassium content, about 104 milligrams per fruit, helps relax arteries, reduce blood pressure, and ease fluid retention. That makes plums an ideal choice for diabetics at risk of hypertension or early-stage nephropathy. On the neurological front, plums contain chlorogenic and caffeic acids, which have been linked to reduced neuroinflammation and better communication between nerve cells. Regular consumption may help ease numbness, tingling, and burning sensations in the hands and feet by restoring proper circulation and calming the overactive nerve responses caused by chronic blood sugar spikes. For the heart, plums offer subtle but consistent protection. Their combination of soluble fiber, potassium, and anthocyanins helps regulate cholesterol, reduce LDL oxidation, and support endothelial function, the smooth lining of blood vessels that become stiff and inflamed in uncontrolled diabetes. Over time, this can reduce the risk of heart attacks, stroke, and diabetic cardiomyopathy. They also support brain clarity and emotional balance, thanks to their antioxidant and gut-friendly effects. The fiber and prebiotics in plum skin improve gut bacteria diversity, which in turn supports the gut-brain axis, a key pathway for controlling appetite, mental clarity, and mood swings in diabetic patients. For joint health, plums contribute on multiple levels. Their vitamin C aids collagen repair, while the phenolic compounds reduce the expression of inflammatory cytokines involved in arthritis and joint degradation. In fact, research on dried plums has shown measurable improvements in bone density and reduced risk of osteoporosis in older adults. While fresh plums are preferable for blood sugar control, the underlying joint-supportive phytochemicals remain effective in either form when portioned properly. This makes plums especially valuable for diabetic seniors dealing with stiffness, joint inflammation, or early osteoarthritis. What's more, plums help the body fight cancer. Their skin and flesh contain quercetin, chlorogenic acid, and neochlorogenic acid, polyphenols that have been shown in lab studies to kill cancer cells without harming healthy cells. This selective toxicity is especially promising in protecting against colon, breast, and pancreatic cancers, which diabetics are statistically more vulnerable to. These protective effects are amplified when plums are consumed as part of a high antioxidant, low inflammatory diet. A common myth is that plums and prunes are too sugary for diabetics, but that's only true when they're overconsumed or eaten alone. A single fresh plum contains less sugar than a slice of white bread, and when paired with protein or fat, the sugar release becomes even slower and more stable. The key lies in portion and pairing. And unlike many high-sugar fruits, plums also help regulate appetite and prevent cravings by improving leptin sensitivity, a hormone that controls hunger and satiety. For a naturally sweet, blood sugar-friendly snack, try slicing one plum and mixing it with a few pumpkin seeds, a small spoon of Greek yogurt, and a pinch of cinnamon. This combination supports digestion, balances post-meal glucose, and keeps you full longer. In the morning, plums can be chopped into a chia pudding base made with unsweetened almond milk and flax meal, offering a high-fiber, high omega-3 breakfast that supports both insulin and digestive health. At lunch, grilled plums can be added to a spinach and walnut salad with a splash of balsamic vinegar and olive oil, creating a flavor-rich, nutrient-packed bowl that supports blood pressure and joint recovery. For dinner, gently roasted plums alongside a baked salmon fillet and steamed broccoli create a satisfying, antioxidant-rich plate that nourishes the eyes, kidneys, and heart. A reasonable serving size is one medium fresh plum per meal, and they can safely be eaten up to twice daily when paired correctly. Overripe or dried versions should be approached with care. Dried prunes are more concentrated in sugar and should be strictly limited to 1 to 2 small pieces per serving if used. Canned plums in syrup should always be avoided due to their high glycemic impact. Also, diabetics with advanced kidney disease may need to monitor potassium intake, so always check with your healthcare provider if this applies to you. Bonus tips for diabetics. Here's something most people overlook. How you combine and time your fruit matters just as much as the fruit itself. One of the best ways to enjoy these diabetic-friendly fruits, cantaloupe, apricots, and plums, is to eat them after or alongside protein-rich meals, not on an empty stomach. This slows the breakdown of natural sugars and helps prevent sudden blood sugar spikes. Another powerful tip is to rotate your fruits instead of eating the same one every day. This ensures a broader range of antioxidants, minerals, and phytochemicals that support different systems like your eyes, joints, pancreas, and kidneys. If you're someone who battles cravings or late-night hunger, using half a plum or a few slices of chilled cantaloupe as part of a light protein-based snack can prevent nocturnal glucose crashes without triggering a spike. And don't forget your gut. Pairing these fruits with chia seeds, flax meal, or unsweetened yogurt creates a natural prebiotic, probiotic synergy that calms inflammation, improves digestion, and boosts insulin sensitivity. Lastly, the temperature of your fruit makes a subtle difference. Room temperature fruits digest more gently, while cold fruits may briefly slow digestion, which can be helpful in managing post-meal glucose curves when timed right. Small changes like these can turn these fruits into powerful tools for managing diabetes naturally, meal by meal, bite by bite. Which of these 3 fruits do you eat most often, and how do you prepare it? Share your favorite way to enjoy it in the comments below. And if this video helped you or someone you care about, hit the like button, subscribe to the channel, and turn on the bell so you never miss a science-backed guide designed just for diabetics. Stay consistent, stay curious, and stay healthy, because real healing begins with knowledge.